let's move on to the last one. Now, Sarah, I know you love a good Florida plastic surgery story.
Some Florida tea.
Yeah.
Plastic surgery tea.
So I actually looked this up. So we talked about this. It's been about a year and a half. I'm asking if you remember this. Do you remember the plastic surgery? And there was this, unfortunately, this patient died where the anesthesiologist was like not an anesthesiologist. Do you remember that one?
Yes.
Okay.
I think so.
So this is that one. So for the people who I mean, it's been a long time, Sarah, and we talk about a lot of like bad surgery outcomes. So I don't blame you. I vaguely remember once I was like, I think we did a segment on this. This was, so I'm gonna recap this for you. So this was a 26-year-old patient that was having a Brazilian butt lift, which you know I hate Brazilian butt lifts. I don't like them.
In Florida.
Yeah, it was in Florida. And she was having a breast augmentation as well, and this happened in 2021. Surgeon was Dr. John Neese, and the anesthesiologist was Dr. Millicent Muir.
It wasn't an anesthesiologist.
And it wasn't an anesthesiologist, right. The anesthesiologist, or the person acting as anesthesiologist, was an OBGYN. And they were doing, and I hate this so much, they were doing this pretty major surgery without general anesthesia. So they were doing it under local with sedation, which I hate. And it was supposed to be a level 2 conscious sedation, which means that they sedate them, but they're still awake. But apparently, according to the log, the patient got as much drugs as to be a level 4 sedation, which is like one of the absolute highest. I don't know if it's the highest. I don't think so because it's not paralyzed. But like for level 4, like you need to be intubated, meaning have a breathing tube, and they didn't have that. And so the patient ended up suffering cardiac arrest during surgery and never recovered and unfortunately passed away. And so we talked about it was just so crazy that they had an OBGYN of all people acting as the person giving, the anesthesia. And to be fair, like they didn't actually put the person under general anesthesia. The reason they didn't intubate him is because an OBGYN would never.
Know how to do that.
They wouldn't do it, right?
Yeah.
They would never do that. They were just there to push the drugs, and but like the person wasn't apparently super skilled at it because the patient got way more drugs than they should have, which probably was a factor of them being uncomfortable in surgery. That's probably why they gave them more drugs to make them comfortable so they could pull off the surgery, and then they got too many drugs in there and they went in cardiac arrest, probably from hypoxia. They quit breathing, and the patient died. Yeah. And so here's the crazy part. So this is the update. So this is kind of bonkers. So Dr. Muir, who is the OBGYN, who is the acting anesthesiologist, has lost her, I think it was female, Millicent. Yeah, it was her. Lost her license to practice medicine.
Good.
Yeah, I mean, it is good because I think that, if you're an OBGYN acting as an anesthesiologist, that you're potentially opening yourself up to trouble. But what's crazy is Dr. Neese, the surgeon, who is overseeing, he was supposed to be overseeing Dr. Muir and making sure that Dr. Muir was not doing more than she should have, is not lost his license. Now, how does that make sense? Now, there is an inquiry. He does have an inquiry into him, which means that they are looking into it. But as of right now, this guy's out there operating. But the person that he was supposed to oversee and actually
hired as an anesthesiologist
to make sure that the patient, was able, got safe amount of drugs.
They're both morally unsound, for sure.
Yeah.
They don't.
And this guy, Dr. Neese, has had some other disciplinary actions in the past. Nothing like, earth-shattering, but there's been a few things. But yeah, so I want to comment on this one. And I want my people, like my marketing people, to clip what I'm about to say, because this is super important. If you are thinking about having plastic surgery, and you're thinking about having major plastic surgery, absolutely have general anesthesia. Like doing this under local with sedation is just a very, very bad idea. Now, I've done some small stuff myself under local with some light sedation, like really small lipo. I actually did a couple of breast augs under local with some sedation, really just to see how the patients did. But I did it in an OR, which was a little bit different than a lot of times these are done in the office. They went okay, but like I just wasn't a fan of it. Nowadays with anesthesia being so safe, there's just no reason not to go under anesthesia if you're having major surgery. It makes it so much safer because I can almost guarantee you that what happened in this case, this patient was having major surgery, which I would never attempt to do what they did under local with sedation, and the patient either was uncomfortable and they pushed too many drugs, or another thing that could happen is they had to give so much local anesthetic, the patient, went in cardiac arrest from that. There are just so many bad things that can happen if you have major surgery without general anesthesia, or without at least an anesthesiologist there to oversee it. And this happens all the time in the United States. I know a patient I just took care of that went to one of those places, these plastic surgery mills here in Dallas, and had a really bad outcome. And it was the same thing. She did it. It wasn't general anesthesia. She got hypoxic during the case, and luckily she didn't die, but she had a really bad outcome. And I just see this time and time again where people try to get these big surgeries without general anesthesia, and something bad happens.
Yeah.
So
it's like always usually the first red flag of any of these stories.
Right. Yeah, it is. I mean, and I'm not saying it can't safely be done, but it just opens you up to so much risk. I mean, the people who are doing it are, the reason that surgeons are doing it is because they're trying to make it very, very cheap, or they're shady enough that like no anesthesiologist will work with them. I mean, that does happen because that happens a lot when it's like non-plastic surgeons doing it. Like they're not going to get someone that's going to agree to put a patient to sleep, so they do these conscious sedations.
Yeah.
And this guy actually was a board certified plastic surgeon, but I think he was at one of those plastic surgery mills. That's why they did it that way. It's just not as safe as it could be.
Right.
And it is surgery, and these are major surgeries, and so you're just putting yourself at risk. So if you have friends or think about going to plastic surgery, I'm so against doing major surgery without general anesthesia.
Yeah.
It's just, you want to be safe. Like, it's not worth your life, or having like a horrible complication and then having to pay all this money afterwards. So I think probably eventually this guy is going to lose his license.
I would think so.
I mean, that's pretty egregious. Like, I personally would find it to be malpractice what they did. To do that big of a surgery under light sedation is just, it's unsafe. I would totally, I personally would testify against them.
Yeah. That's crazy.
Yeah.
He should find a new job.
It happens a lot. I mean, it happens more than you think.
Yeah, so. He should take this time to find a new
new hobby, new career.
New career, for real.
All right. Well, if I have any more updates on that, I'll let you know. So I think that's all we have time for today.
Thanks. That's some spicy tea.
Spicy stuff today. All right. Well, it's good to see you guys. I know we had a couple weeks off. It's good to be back. Get back into the swing of doing topics. If you like these segments, please leave us a comment and let us know about it. And also let us know if you have anything you want us to talk about on the next episode of Nip Talk.